Hello, it's Dr. Haddad, Chief Staff of the hospital. Hope you're doing well and staying safe. This is an update from Blue Water Health as of today, December 22nd. So far, our operations are as per usual for this time of the year. It's always busy in the winter time. Having said this, our bed occupancy at the hospital is fairly acceptable at 75%. The ER is unusually busy. It's not unusual though for this time of the year. Our ICU is fairly full. It's almost at 100%. Half of the patients in the ICU are critically ill patients with variety of medical and surgical issues. The other half is COVID-related illnesses in the ICU. We are planning for the next couple of weeks for the holiday season slowdown in our clinics and elective ORs. Our staff need a bit of a break as well. It's been a very long year for everyone. At the same time, we're fairly busy preparing for the next few weeks, especially in light of the fact that we are witnessing a rapid increase in COVID cases in both the community and the province at large. Certainly, this increase is due to the latest iteration, the latest variant of the same virus that causes COVID, Omicron specifically. It seems to have overtaken Delta as being the dominant variant now. There's a lot of reports from different places in the world that are a bit conflicting still. Some seem to indicate that the virulence or the amount of disease or severity of disease that the virus causes might be less than Delta. It remains to be determined when these when that applies to our own local population, which has a different demographics than many other places in the world from an age standpoint, for example, or immunity standpoint. Nevertheless, while it's helpful and hopeful, we need to remain vigilant and prepare for all case scenarios. It's quite conceivable that the lower virulence that is being noted in the UK and South Africa, for example, could also be due to a higher level of community immunity from prior infections and higher levels of vaccinations. Nevertheless, we'll see how the numbers play out over the next few weeks. Clinical data will become more available in our continent, both in Canada and the US, over the next few weeks as we see more patients with this particular variant infections. For the time being, all we can do is be ready and be prepared. We need your help as well, as the hospital by itself is the last line of defense. The best thing we can do is to get vaccinated, get a booster if you're vaccinated, get a vaccine if you haven't been vaccinated, and also, in addition to it, reduce social interactions to reduce the chance of an infection or infecting someone else. We are expecting way more community infections this time around with this variant. Omicron seems to be, it's shown to be fairly more contagious, very transmissible, much more than Delta before it. Certainly the virulence level and how much disease it causes still needs to be determined. But nevertheless, even if it's half as virulent, if you have twice as many patients because it's more contagious, then we're back to basically being even. So from a system standpoint, we don't know how many patients we will be seeing, so we have to be prepared. Rest assured, though, that we will do our best to take care of anyone who's ill or sick enough to require hospital services. We're all in this together as a community. Anyone who's sick needs to be looked after, and we need to go beyond thinking about this in terms of vaccine or unvaccine, because if the hospital's too busy, then somebody's care might be displaced regardless of their vaccination status, for example. We're just all one community fighting this together. Omicron does have many mutations. It makes it more evasive, which makes the current immunity from vaccination less effective to stop the initial infection, which is the first line of defense. So we'll have more cases, more infections recorded every day by the province. But once someone is infected, vaccination, existing immunity will help mitigate the impact of such infections, and the hope is that the severity of illness will be diminished, and therefore the need for hospitalization will be less. How that plays out will depend on who is being infected, how many people are being infected, their immune status, their age, their pre-existing comorbidities. So all these details need to be, we'll have to wait for the numbers to play out over the next few weeks. So as a hospital, we are preparing. The staff is stretched thin. It's been a long year for sure with this pandemic. But we need to be vigilant, we need to be prepared, but we need your help as well. In the meantime, I'd like to wish everyone the best of the holiday season. Take it easy. It hasn't been an easy couple of years for sure, especially for friends and families at this time of the year. I remain hopeful myself that 2022, hopefully we'll see the end of this. We'll see. I really hope so. And thank you for all you do in terms of supporting the hospital, supporting our staff. And I would like to, on behalf of our staff, thank everyone in Sarnia-Lambton, especially our first responders from EMS, fire, and police, in addition to everyone who works in healthcare, from pharmacies, primary care, long-term care, home care, both inside the hospital, outside the hospital, and also everyone else in Sarnia-Lambton who's been keeping all of us afloat. Fire, hydro, grocery stores, maintenance, city workers, everyone else, our teachers. So thank you so much. Let's hope for the best and prepare for all scenarios. Thank you.